Hello, everyone. Welcome in this free webinar. I'm Dr. Mahwish Mubashir with you. In the first in the first webinar of the webinar series, you can look at the screen and you will find the topics of our webinars. I have collected some questions from the students and I wanted to address them step by step. So I wanted to conduct this webinar series for MRCOG1 students. Students definitely need full guidance about the exam, and there are a lot of confusions about past papers. So we will discuss those as well. Please, guys, take care of your mics after joining the meeting. Don't put your mics on. Also, we have to understand what steps you need to take before starting the preparations. Okay, and definitely I will guide you throughout your preparation journey. And for that, you should know that who can provide you best help in the preparation. So everything which is given, and you have got the dates as well. And it's a good news that we are going to start our July 2025 comprehensive study group, our course, July course, from tomorrow, and you will get the orientation session tomorrow. All the course students, keep the date in your mind and keep your energy very high because that's true that we are discussing all these four topics, but from tomorrow, the real journey of your preparation will begin, inshallah. I'm very happy to announce that our students, when they took exam, which was conducted by our COG on 21st of January, and they all were very happy. Um, is my voice is not audible for all the students, or it's just a problem for one? Yes. Can somebody else inform that is there a voice problem with everyone or not? Let me check with the team as well. Well, the voice is okay from my side, and I will check that. All right, I have fixed this. So let's restart. If the voice problem is fixed, let's restart and talk about this further. Okay. My dear, the voice is a problem for you only, so please check your device and connect yourself with the team. I'm writing this in the chat box also. Please leave the session and join again. Okay. So I'm here to give you the full information about MRCOG. When you plan to attend this exam, I want you to ask yourself a few questions. These questions are very important. These questions are so important that if you understand why I'm asking you these questions, this is because I want you to get an orientation about your own self, that what you want from this exam, why you need MRCOG. You can use the chat box to write your answer. You can interact by opening the mic. And of course, you should write your answer on a paper, or you can discuss the answer with me as well. Why you need MRCOG? Definitely, you have become a doctor. Hello. Yes. Guys, after joining the meeting, please turn off your mics. Thank you. So, of course, you've already become a doctor and you want to polish yourself. You want to get a specialty degree. You want to become a specialist. You want to become a very good obstetrician and gynecologist. And definitely, it's the main purpose that you will opt this exam and you will prepare for that. And what is the additional benefit? You are getting a degree. But what is the additional benefit of MRCOG to your primary degree? I have written this thing primary degree because a lot of you, a lot of doctors, they already have a qualification, a post graduation degree in obsgyne, or they are the residents or the trainees of obstetrics and gynecology. So what they have, they can have FCPS, they can have MD, MS in this subject, and in from whichever country you belong, this additional MRCOG degree is having a lot of benefits, and it will keep on benefiting you for your rest of life. If you become member of RCOG, you get this membership, then definitely it's a prestigious. It shows that um you have a very good qualification, and you are a very good doctor of your specialty. Then part two of MRCOG is based on all RCOG guidelines. When you prepare for this exam, you revise the guidelines. If you're already an obs-gyne specialist, you revise all these guidelines and you study them in so oriented way that you get a lot and a lot of knowledge. So it gives you a benefit of becoming a good doctor, which is dealing his or her patients in a better way. And after deciding that what are the answers of these two questions, what is the third thing that you should know, that how much time you can manage for the studies? A lot of students, a lot of students, they make this mistake. What they do, they get very much excited about the exam, and they just think that if they book the course and if they book the exam and that's all, they will not need time for the preparation. It's not true. Even if you are a specialist of your um of this obs-gyne, even if you are done with FCPS or MS, even if you are studying daily, you need a good quality time for your exam, for this exam. MRCOG is not a simple, or you can say it's not an easy exam if you do not sit and prepare. So you should ask yourself that if I am a mother of kids, if I am a doctor who is working, if I have a family to take care of, can I sit and manage to study daily or not? If your answer is no, then I would say, guys, take a break, do your responsibilities, which you are primarily responsible for. Do those tasks first. Like if you are a mother, you are supposed to take care of the kids more than your studies, I would say, because it's a thing which requires time. So if you can't manage time, you should not book the exam. Then, if you are a mother and the help is available to you and you can make time for the studies, then yes, I'm here to help. I will make the things simple for you. I will give you correct syllabus and correct material so you can read and study in a smart way. We will talk about smart study methods, and I will guide you more and more that what is smart study and how you can save time for post graduation exams. Then I will guide you. But after asking these three questions to yourself, after these three questions, that you are done with taking a few steps like managing household help or managing the time for the studies, then you should take your first step of preparation. Let's go further. Now I will give you a brief description about the MRCOG exam. First thing, it's a membership, it's not a fellowship, and you should know the difference. 4 year specialty experience is required before part 3 of your MRCOG, not before part 1, not before part 2. What is part 1? It's the basics of obstetrics and gynecology, and I will give you the syllabus outline as well. Sorry. What is part 2? I've told you that it's based on RCOG guidelines and all the clinicals. The role of clinical questions are less in part 1. Okay, part 1 questions are simple. If they are based on clinical management or data interpretation, these are very simple. But I would say that part 2 exam is very much difficult than part 1, and this is actually you can say it's an entry level exam of this specialty exam, I can say. But part 2 is definitely a difficult one. It has a huge syllabus, and you definitely require a lot of time and a lot of clinical expertise, I would say, to sit and clear. And part 3 is like an OSCE exam. Okay, you go to their center, which is made for the OSCE, and uh, you attend this. And I would give you this, good news that part 1 is most simple and easy part. Part 2 is difficult, but we have a very good mentor, Dr. Zabe, with us, and she helps students. And it's the very it's the very thing that our students can't clear the exam, because we are very much sure of this thing that we provide updated and good syllabus, concise one, and our students definitely clear exam easily. It's a big help. And part 3 is also that Dr. Zabe helps a lot of students to clear this part very easily. So because of this thing that we are talking about part 1, and all the students who have joined me in this session, they are from part 1 only. So we will go into a little bit detail. Your exam is 200 SPAs. Can you tell me what is an SPA? Can you tell me, guys? SBA. What is SBA? An SBA, single best answer, is like it's a statement of the question. Then you find 5 options and you will correct the best one. You will select the best one. Okay, the correct one, the best one. All the 200 questions are asked this way. They will give you a statement, not the scenario based. No, my dear. Single best answer. Single best answer. So you will choose the best one. Your part 1 exam is not all scenario based. There is a part clinical management. Clinical management part is all about scenarios. They will give you the description of a patient and they will ask you to diagnose, or they will ask about the management of the patient. But SBA means single best answer, and there are 2 papers, 100 questions in each, and they will give you 1 hour break time or 1 hour refreshment time, whatever you can say that. And that's all. Please give me 1 minute. Okay, I'm back. Okay, so now these are the subjects for part one. On the left side, guys, these are major subjects. Please take a screenshot of this slide and keep this with you. I will keep on guiding about all the subjects one after one in the course, and I will guide you that which subject carrying how much weightage in the exam and how many questions they will ask from which subject. I will keep on telling you. You can see the schedule I have shared. It's a module wise schedule. We will start with anatomy and embryology, a major subject and minor subject, but these two are linked together in a way that if you read the anatomy and you cover the embryology together, you retain these two topics very well. Then physiology and endocrinology module, then pharmacology. Um, it's a single subject in the module three or four, I would say. These two are covered in a module. Pathology is a separate module. Biochemistry and genetics, two minor subjects in one module. Biophysics, a part of data interpretation. Immunology and microbiology are also covered in one module. And there is also a good discussion session and question answer practice on the biostats. So these are the minor ones and major ones. Now you have to understand a few things. First thing, guys, important one. You can't afford to miss minor subjects. Like a student who just attended exam asked me 2 days before exam that I want to leave stats question totally. I can't read the questions. I don't have time to practice it. So I forwarded her very clear and concise notes, very short notes on stats. I have made those notes for the students. I gave her the notes and I told her to practice like 50 questions. And she was able to solve all the questions they asked in the exam. How many those questions were? In the exam, they used to ask 10 or 8 questions from these two. And almost all minor subjects, they ask below 10 questions, I would say 2 or 3, 5 or 6 from all these subjects. But you cannot leave these subjects behind. You cannot totally leave these subjects behind. But you can spend like less time. Spend less time in the preparation of the minor subjects and spend more time on these subjects because they will ask 20 to 30 questions from each of these. The time management is the key for the preparation. Okay. If they are asking 25 questions from anatomy and you spend 1 month preparation in the preparation of stats only, and you spend only 2 days on the anatomy, is this justifiable? Of course not. You should spend at least a month on the anatomy. If you can afford to spend 1 month on one subject, do the bigger ones and spend less time on the minor ones because they are going to ask less number of questions from these and more number of questions from these. So take a screenshot of this slide and keep it with you. And as I have promised that I will keep on guiding you about all the subjects and modules. Now I have a few very important tips for you all. The first thing, all the students who are attending the webinar today are the ones who are about to start the preparation. I would say do not doubt yourself that you cannot go through this journey. Why I say journey? I say it's a journey because I'm responsible for teaching you step one, but we have step two and three. So I call it a journey. I want you to go through all the steps very smoothly. I want you to clear all three steps, all three parts of this exam, and you become MRCOG with us. I pray for that. Okay. So don't doubt yourself. Take one step with this confidence that you have a good guidance, you have a good teacher, and you will definitely clear one step and then you will go towards the second. Okay, do not doubt yourself and do not delay your first step. Do not delay your first step. Do not keep on thinking about the exam, and if you have this plan in your mind that you want to become MRCOG, do not do not make this mistake of taking the first step after years. Start now. Okay, start now. Ask yourself those three questions I mentioned in the start. Ask yourself these three questions and then start now. Take part one and then prepare for part two and then go for that part three. You should have a complete information about the syllabus and exam pattern. Now, previously, RCOG was conducting the exam like they were asking true false questions in half of the paper and then half was SPAs. So in past papers that belongs to 2012 or 2010 or 1999, very old papers, students try to get those files and they read past papers with true false questions. Very big mistake. No need to read true false questions. And in some old books, the authors who are very old, so before 2012, if you have any source of pools or of questions, so you will find true false questions. And if you are spending time on solving true false, no need for that. Go for the practice of the thing which is actually coming in the exam, that's SPAs. Syllabus is very important. Syllabus is very important. Mostly the students who are done with FCPS or PLAB or any other exam of their country, what they think that that information is going to help them and they don't need to prepare more for MRCOG. That's a big mistake, guys. You should understand that MRCOG has its own syllabus and you should have that information for that only. Then you will prepare that. And what is that? Certain and specific syllabus. That's OBS Gynae. That's OBS Gynae syllabus. Okay. You know the physiology, you know the anatomy, but you are supposed to know the anatomy of the pelvis and perineum more than anything else. You are supposed to know the physiology of pregnancy and lactation and fetal physiology more than anything else. And you have memorized everything from the anatomy, but you have left behind the pelvis and the perineum. You are going to fail the exam because they ask more and more questions which are related to OBS Gynae. Okay, so this is very important to understand. Another mistake which students do, and I keep on guiding them that don't make this mistake, is joining a lot of social media groups and a lot of platforms for the study. Join one, follow the syllabus, and don't get distracted by joining hundreds of groups. Okay, join one only and follow that. This is another thing that you should make a doable schedule. Now, a student is with me, and she was saying that she will be very busy in March, April, and May, June. So she's trying to cover everything in these 2 months, January and February. And I asked her I asked her that, okay, show me the schedule you have made. She said, I will finish the anatomy and physiology in only 3 days from that book and that book. And I was like, wow, can you do that? Because I cannot do that. I know the anatomy of MRCOG, but I cannot cover the anatomy in just 3 days with the physiology, with the past papers. So make a doable schedule. Don't make this mistake of becoming very excited and very energetic at wrong time. At this time, in the start, you should be consistent. You should be consistent and you should study daily. What you are studying, it should be a very good plan, like one topic a day or two topics a day. That's all. Sorry. If you want to cover the whole subject in one day, it's a mistake because near to exam, you you will, it will fade away from your memory, and then you have to revise it again. So be consistent in the start. Try covering 1 to 2 topics a day. Try sitting in the recalls group daily. Stick to your schedule and make a habit of studying first. Then put the energy more and more, and then try memorizing everything which is given in the notes or in the books. So every student asks which books we need. I tell you that with the course, you don't need any book at all. Any book at all. Don't get any subscription, don't buy any books, hard copies, soft copies, no need at all. We provide everything in the course, but if you plan to read anything, you can follow these two theory books, only these, nothing else. SPS tools, a lot of days are available, and I've shared in the free material group as well. You can download them and read, but keep this thing in mind that these are not updated books. So don't follow blindly the ones which are the older ones and not updated. Past paper files all are available in our groups, and definitely in your past paper discussion group. You will cover everything with me. So this is all about the books. What our comprehensive course, which will start from tomorrow, is having. Firstly, we will cover all these 14 subjects in live session module wise, and you will get the recordings as well. I give my own written notes to students. Okay. I give my own written notes to students for the preparation, and definitely those notes are very helpful. Why I have made those notes for the students? Because I know that the books are very old. I know that getting information from all the books and summarizing them and memorizing till the day of your exam is hard. So I have made short and concise notes. You just read them and solve the questions subject wise and solve the recalls daily, and definitely you will get very good percentage in your exam. 14 days revision workshop is also included in your comprehensive study plan. In 14 days, we will revise one subject daily, and you can ask the students who just attended the January exam workshop, and they were very happy about revising all the subjects. And we have Telegram groups for everything, and definitely there will be a mock exam before you attend a real exam so that you can evaluate yourself, you can assess yourself, and that's all. And guys, you can send me if you have any questions in your mind. Let's close the webinar. Before closing, I will repeat that we have four free webinars planned. On 25th of January, we have orientation session for the July course. Our students will start preparation on right time because everybody is working and everybody is having kids and other responsibilities also. So we will start studying at right time. All the four webinars are there to give you a good guidance about the exam, about the study material, about the method of the study, and definitely why and who can provide you the best help in the preparation. Thank you, my dear. See you tomorrow in the orientation. Bye bye.